The rotator cuff itself is a tissue that comes out and attaches in the ball. The cuff rotates around. The bone is attached to the muscle, so when the muscle pulls the tendon, which is attached to the bone, the arm raises up. Rotator cuff injuries are common. I would say a majority of them don't go on to need surgery, but being that the shoulder is the most mobile joint in your body, allowing you to put your hand in so many places, it actually is a joint with the most liability and most chance for injury. The analogy I use in the office is kind of like a river running past a rock. Over time, that's just going to cause a little bit of wear, and you wear away the rock. Most commonly, the reason I see folks that have a rotator cuff symptoms or complaints are really just basically pain. And they're complaining of shoulder pain. Oftentimes they can't sleep on that shoulder well or not very long. Anti-inflammatories can help for a while, but if you have a serious injury to the rotator cuff, really nothing you're going to do to it is going to take care of that pain. And you probably need to see your doctor, and then they can make appropriate referral and do special tests to help you decide what's causing your pain. Rotator cuff tears can be caused traumatically with patients who fall out on an outstretched arm with the arm over the top of their head or onto the shoulder. But I would say a majority of the ones that I see are attritional tears, which just mean wear and tear type tears. Most folks are pretty tough and they deal with it and medications help, but once that tendon tears off, there's really not anything they can do to make themselves more comfortable. So those are the two main reasons that people come in for rotator cuff tears. Rotator cuff tears are treated routinely surgically. Rotator cuff surgery is routinely done as an outpatient procedure. A lot of them can be done arthroscopically through small microscopic incisions of about 1 centimeter, again just a little bit bigger than 1/4 inch around the shoulder, where we move that tendon back and implant it into the bone with various anchors and suture fixation techniques. It takes about 4 to 6 weeks biologically to get that tendon to get sticky and stick back down onto the bone. The first half of your therapy, 6 weeks, is aimed at really just getting the motion back. The balance of the 3 months of therapy is then starting to strengthen, and I tell patients when I diagnose that rotator cuff tear and talk to you about surgery, you're looking at probably a year recovery from that. It doesn't mean you're going to be in terrible pain all that time, but I expect it to take a year for you to feel pretty normal with that shoulder. And that's the time I'm always happy to be proved wrong. Kind of at the first hint of some shoulder pain, if the first week or two of things you're trying on your own aren't helping, get with your doctor and identify really what's going on. Because certainly there are some things that we can do to prevent small irritations of the rotator cuff becoming a bigger problem into a tear that requires surgery. And really, the mainstay of treatment for that are decreasing the activities, if possible, that are making things worse, but really doing things to rehab the shoulder and strengthen the rotator cuff complex.